Hello viewers, today we will discuss about the use of sildenafil in erectile dysfunction. See, now what happens, people who are having sexual dysfunction, sometimes they just go to local pharmacy, they buy sildenafil tablets and they use it for sexual dysfunction. Young people, even though they don't have sildenafil, they don't have any sexual dysfunction, they use sildenafil only to boost their pleasure. They are using this sildenafil as a pleasure drug, actually, which is a wrong way. Actually, sildenafil should not be given without prescription. It is a Schedule H drug. This should not be given without prescription. There are some disadvantages with this sildenafil. There are some advantages and there are some disadvantages. Now, advantage is okay, it gives a very good erection and it avoids failure during intercourse, it boosts your confidence and it makes you the failure. See, once there is a failure, the failure continues, it will haunt you. So, now at least even if you have multiple failures, sildenafil will break that barrier and it will give you a successful intercourse when you take it. But coming to disadvantages, so sildenafil is available. First thing you have to understand is sildenafil is available in 3 dosages: 25 milligrams, 50 milligrams and 100 milligrams. So now if you start with 25 milligrams, now after some time then 25 milligrams may not work, then you have to take 50 milligrams, then you have to take 100 milligrams. Then after 100 milligrams there is nothing, because you can't increase the dosage because it's not good for your heart. So 100 milligrams is the maximum prescribed dosage. Now, if you are addicted to sildenafil, so that means if you don't have any problem, if you keep taking sildenafil only as a pleasure drug, the main disadvantage is the day when you are not taking sildenafil, psychologically you feel less confident. Then that low confidence itself can lead to failure. And once there is a failure, then again next time when you are planning for intercourse, you can't do it without sildenafil. So always then it's a cycle. You tend to take sildenafil, then have intercourse, then even when there is no sildenafil, then slowly your confidence, since your confidence levels are on the lower side, you will avoid intercourse. That means basically you are addicted to sildenafil. So this is the biggest disadvantage. Second one, sildenafil is an on-demand drug. It's not a daily dosage. That means if you want to have intercourse, you have to take a sildenafil, but this can't give you any protective effect on the penile vascular damage. So that means if there is a damage, penile vascular damage, if you can identify it in early stages, so then it's an advantage for us. We can actually cure it. You can actually find out why this is happening. You can find out the root cause for this, and there is a chance to cure this problem. But if you continue to take sildenafil in the initial days, and anyway your sexual life may be normal because you are having intercourse by taking sildenafil tablet, but we are losing precious time in identifying the root cause and treating. So sometimes what happens, if you identify the root cause at very late stage, then by the time the chance of completely curing this problem is lost. So basically we are at loss, and there you have to continue on medications itself. So now, and third disadvantage is, now there are so many other medications which can cure the erectile dysfunction problem. And now there is tadalafil, there is avanafil, vardenafil. Tadalafil is more beneficial than sildenafil because tadalafil has more advantages and very less side effects. So side effects of sildenafil are, you feel feverish sensation, burning sensation in the eyes, redness in the eyes, and body pains, headache. These are common side effects of sildenafil. And sildenafil should not be taken by patients who are having heart problem or who are taking medications for heart disease. So you have to take a doctor's opinion before using sildenafil, whereas other drugs are safer drugs, and taking tadalafil on long term can actually cure your problem. But not only tadalafil, you have to take other supporting medications to cure the actual root cause of the erectile dysfunction. So viewers, taking sildenafil as a pleasure drug should be avoided. If you have erectile dysfunction, you better consult a local doctor, find out the root cause and try to treat it. 20 years ago we didn't have any solution for erectile dysfunction. Those days when Viagra was actually introduced to the market, that was like a blessing. No, we didn't have any other medication. Those days, taking sildenafil gave us good improvement in the sense it was a very good on-demand medication. So, but now there are the science has evolved. The understanding of sexual dysfunction or erectile dysfunction is very good now. We can actually pinpoint the cause for a sexual dysfunction and treat it. So, don't get addicted to sildenafil. Thank you.